Oh my gosh, flashing lights. Ah!
Oh my god, the patient is seizing. Partner, can you draw me up 10 milligrams of iamidaz?
I got your Madaz.
Thank you. Make sure you give iamidaz in the vastus lateralis.
Stab, squish. Oh my gosh.
Sir,
What happened?
how are you feeling?
I'm exhausted.
My god, you are having a seizure. I had to give you midazolam.
Madaz, what's that?
Midaz? It's a benzodiazepine.
Guys, I'm freaking out. That was so stressful.
Partner, are you having an anxiety
I
attack?
think so.
Oh, well, it just so happens that I have another benzodiazepine. Ativan. Take this, PO.
Thank you.
How are you feeling?
I feel so much better.
Wow.
Oh my gosh, you helped her with anxiety and you helped stop my seizure? All with benzos?
Let's talk about benzos!
Wow, that sure was a lot of applications of benzos in the pre-hospital setting. Managing a seizure, anxiety. You must have so many questions about how benzos work and when we give them in the pre-hospital setting. Let me pass it over to Abby, and she can tell you a little bit more.
Thanks, Tegan. To understand benzos, we first have to understand GABA. GABA receptors are our primary inhibitory receptors in the CNS. GABA binds to orthosteric sites on GABA receptors, opening the channel and allowing chloride, a negative ion, to flow into the cell. In turn, the inside of the cell becomes more negative, or hyperpolarized. This leads to an increased threshold needed to fire off an action potential. So how, Tegan, does this relate to benzos?
Thank you so much, Abby. So, why do we care about benzos? Well, benzos are going to bind to a secondary binding site of the GABA receptor on the main chloride channel. What is that going to do? Well, it's going to increase GABA's affinity, its attraction to binding to the main binding site, causing the chloride channel to open more frequently and allowing more chloride to flow inside the cell. Why do we care about that? Well, it's fantastic at preventing seizures. By reducing the amount of action potentials that are going to be triggered in the CNS, we're going to reduce overall CNS firing and hopefully inhibit any further seizures in the patient. And there's two different kinds of benzos that we gave in this scenario, Ativan and midazolam. Let me pass it over to Leo to tell you a little bit more about those two different kinds of benzos.
All right, thank you, Tegan, thank you. So as we demonstrated, the two medications that are benzodiazepines that we utilized in our example scenarios is midazolam and lorazepam. So midazolam is effective for stopping seizures because it has a very fast onset, so it'll take effect quickly and it doesn't stay in your system too long comparatively to other benzodiazepines, and that's why it's effective in this case for seizures, because we get that rapid onset, we correct that neural excitability threshold, and then we can arrest the seizure without the benzodiazepine prolongating any unnecessary effects. In reverse though, there are other benzos like Ativan, for example, also known as lorazepam, that we can utilize for other types of emergency situations like an acute onset of anxiety. The lorazepam, comparatively to midazolam, for example, has a slower onset, but it metabolizes slower and it lasts longer, and that's why through a lower threshold of effect we can potentiate reducing the anxiety over an extended period of time for patients suffering from anxiety. And that's why we demonstrated anxiety and seizures to show you that the application of a benzo, even though they share a mechanism of action, can be applied in different ways to help with different types of emergencies. However, it is important to note that the emergency setting is not the only place that we're going to come across benzodiazepines. Abigail, where might else we come across benzos?
Benzos are often prescribed by physicians for out-of-hospital use. Some of these uses include anxiety, sleep disorders, seizures, alcohol withdrawals, even muscle tremors. Because benzos are so often prescribed, it's not uncommon for us to see them get abused. Whether intentional or not, benzo overdoses are common. So let's take a look at what that looks like.
Thanks, Abigail. It is important to recognize that due to benzodiazepines' potentiation for CNS depression, that it is easy to come across a patient who has unknowingly and or intentionally overdosed on benzodiazepines. Some of these settings may include out on the streets where you're associating with certain demographics where they have a tendency to abuse medications like benzos that have been cut with other medications like fentanyl, for example. And so unknowingly and or knowingly, they may abuse these medications and potentiate an overdose that will cause CNS depressant effects, and these are quite harmful. So it's important to be aware of the risks when using a benzo and or when coming across them. Other settings where you may potentially see a benzodiazepine overdose is with patients who have been prescribed medications like Ativan for anxiety. Patients who typically get prescribed benzos for things like anxiety can commonly suffer from other medical conditions like depression. And if depression is severe enough, these patients may convince themselves to take their whole bottle of Ativan, for example, and are now currently overdosing on these medications. And because of the potentiation of overdosing in various environments due to benzodiazepines, it's important that we are aware of the indications that may allude us to whether or not they currently are overdosing on benzos. And it is important that we are adept at managing these types of overdoses in the pre-hospital setting and in the clinical setting. Tegan, could you tell us a little bit about how we may manage these types of overdoses?
Thank you so much, Leo. So for managing a benzo overdose, it's going to be pretty simple. If enough benzos are on board, they're going to present with CNS depression, followed by respiratory depression if it's acute enough, and if the respiratory depression is not fixed, it's going to present with cardiac arrest. So it's going to be pretty simple for us in the pre-hospital setting. We're going to be managing the patient's ABCs, holding the patient's airway open with airway adjuncts, and if enough benzos are on board, it's going to present with respiratory depression, which we can alleviate with oxygen, BVM. Most of the time, we're going to be managing the patient and just letting them metabolize any drugs that are in the system, which is going to alleviate any issues that we have. But in some cases of acute benzo overdoses, there is a reversal agent that can be administered by specific paramedics. Those are our IRP ACPs. And it's sometimes also given in hospital as definitive care. This reversal agent is flumazenil. It acts as a negative allosteric modulator. It outcompetes benzos for the secondary binding site on the GABA receptor of the chloride channel. It's going to kick those benzos off the secondary binding site, and it's not going to cause an effect, similar to Narcan. You might be wondering why flumazenil is not given more often in the pre-hospital setting. It's got a lot of cases after administration where it potentiates seizures in our patients. And if we have a patient who's experienced a benzo overdose, we're just managing them, and then we have to give flumazenil as a reversal agent. They end up having a seizure as a result. We've also taken away our main tool to reverse that seizure as our benzos. So it's generally held as definitive care in hospital and given in some cases by very specialty ACPs. You might also be wondering about the different cases that we use benzos in the pre-hospital setting, and let's pass it over to Abby to give you a little bit more.
We use benzos for more than just anxiety and seizures in the pre-hospital setting. Some more protocols where you may encounter benzodiazepines include procedural sedation, sedation for advanced airway procedures, sympathomimetic overdoses, and of course, our favorite, disruptive behavior and excited delirium.
He's fighting me! Someone get them again!